Today we will see the working of creatinine kinetic reagent. The kit is from Biolab Diagnostics. The kit contains one bottle of R1 creatinine reagent, one bottle of R2, and one bottle of standard 2 mg concentration. And instructions for use. We recommend all users to read instructions for use. You may also require pipette, clean and well calibrated, yellow and blue tips, stopwatch, and tubes. The working solution is prepared by taking one volume of R1 and mixing it with one volume of R2. Mix well and keep it for 10 minutes for maturation. The wavelength has to be set in between 490 and 540 nanometer. In our video, we have kept it at 505 nanometer. The standard concentration is 2 mg. As per the machine aspiration, you can either use 500 microliters of reagent volume or 1000 microliters of reagent volume. If you are using 500 microliters of reagent, use 50 microliters of sample. And if you are using 1000 microliters of reagent, use 100 microliters of samples. In our video, we are using 500 microliters of reagent. To prepare this working reagent, use equal volume of R1 and R2, and so in this case, use 250 microliters of each R1 and R2. Mix well and take readings. Do not mix the standard or sample at this stage. We will mix it at the time of aspiration. It is not required to mix it now. Take readings at 20 seconds and 80 seconds at intervals. For creatinine, you can either use serum or patient urine sample. Now, as per the procedure, we need to take three tubes, two for standard and one for test. As you can see, we are mixing R1 250 microliters. We have taken 250 microliters of R1 in all three tubes. Now, change the tip before using R2 to avoid interference. Take 250 microliters of R2 in all three tubes. As mentioned before, the volume of R1 and R2 should be equal. Mix it well and keep the mixture for 10 minutes. Like mentioned earlier, do not mix the standard or sample at this stage. We will mix it at the time of aspiration. Now, program creatinine on semi-automatic biochemistry analyzer. As you can see, we have kept the filter at 505. Select creatinine and proceed further. Run test. As you can see, aspirate water. We are now aspirating water. Take the first tube marked as S. Since we have used 500 microliters of reagent, use 50 microliters of standard. Aspirate this mixture after mixing it thoroughly. After a lag time of 20 seconds, it will again have a reading time of 80 seconds. Save these values and again use 50 microliters of standard and put it in the other tube marked as S. This is to calculate standard concentration, which should be around 2 mg. Please remove the tube after the aspiration. Now there will be readings at intervals of 20 seconds and 80 seconds respectively. The reading time of 80 seconds is also over, and we have received the concentration standard at around 2 mgs, which is exactly what we require. Now use 50 microliters of patient sample and put it in the third tube marked as T. Aspirate this mixture after mixing it thoroughly. And after the interval, we will get the values of patient creatinine. For the expected values of patient creatinine, refer literature. This is the value. Thank you.